All right, guys, today we're going to be talking about urology, nephrology, and why it is so important and why it creates some havoc in our emergency medical lives. It's not so much the problems with the urology and nephrology, it's the other problems that it causes, the cardiovascular side effects, the effects on the respiratory system, the effects on every other system. And so we got to understand how this works, why this works, and more importantly, the reasons that we really need to make sure that we focus on these particular problems that we may have. Now, again, this goes about everything about having to do with the genitourinary system as well. And so, again, we have to make sure that we understand that that system has a lot to do with our pH balance, our electrolyte balance, our balances of water. And it also does things for glucose, and it remains in the bloodstream and it gets rid of toxic wastes. So if you don't have any way to think of this as if you have a bunch of garbage in your house and you just leave it in your house, it's going to continually to make things worse and worse and worse in your house. Same thing with the nephrology system and the urology system. This is what gets rid of waste and makes sure everything stays normal. Okay, so if I can get my slides to advance here. So the urinary, again, it plays a arterial blood pressure regulation. So again, it has a lot of side effects when it's not working correctly. Okay, so it does a lot of things for us, and we got to make sure that we that it was working and working correctly. Okay. Now, again, it removes, of course, the urine. Urea is in the urine. Ammonia is in the urine. And again, it gets rid of foreign chemicals. So what happens when these things are shut down? Okay. When they shut down, again, you don't have that waste being removed, and it throws every other system completely off kilter. Okay. Now, for men, the germ genital urinary system is used. For women, just remember that they don't share any combined. The urethra is shared for the male and the reproductive system. Not so true in the females. Okay, so nephrology is a medical specialty devoted strictly to kidney disorders. Okay, and urology is devoted to the entire urinary system. That in both men and women, by the way. So. Again, renal and urologic disorders are very common, and many are actually very serious. Stop and think about it. The good news is we have good, or I shouldn't say good treatments, but we have treatments that allow patients to live from that. And more than 250,000 Americans suffer from long-term kidney failure or end-stage renal failure. And we're going to talk a lot about that. And usually the biggest causes of those is hypertension and poorly controlled diabetes, okay? And among acute or sudden illness disorders, renal calculi, which is kidney stones, are very common, okay? And again, if you've had somebody the kidney stones, I think everybody will admit and agree that those are extremely painful. Again, men with the same complaint infection of the urinary system, sexually transmitted diseases. Usually when women have a burning pain in urination, it's probably due to the urinary system, okay? And then the other problem is guys have the old prostate, which again, it tends to grow and affects 60% of men by age 50 and 80% by age 80. Yeah, it makes it really hard to pee. Don't worry, guys, you're gonna get there in time. Ha ha. So again, we got four major structures, though: the kidneys, the ureters, the urinary bladder, and urethra. Hey, what could go wrong? We only got the four main things here. Okay, kidneys lie just below the rib cage. They do have the floating ribs that are usually on top of them, but however, they have very limited protection. Again, the ureters come out from the kidneys. It actually goes to the bladder, and then the urethra expels the urine. Again, behind the left kidney is the upper abdomen behind the spleen. The right kidney is behind the liver. Again, healthy kidneys is about the size of a fist. Again, with aging comes the loss of nephrons, so that means you don't produce as much urine. Yes, that's why your older patients start to go into kidney shutdowns, especially if they've abused their bodies, okay? Again, the tissue of kidneys are visible directly in the outer region and the inner region. So it has a cortex, it has a medulla to it, okay? Again, the medullary tissues in the pyramids, and again, this would be an example of the pyramids. The medullas are on the outside, the cortex Here is there. The medulla is on these general areas on the inside. So again, the kidneys, they come together, they form the ureter, and that's where the urine is sent to the bladder for holding. And in which case, now inside the nephron itself. So this is an example of the nephron. We went over this in A&P a little bit. And again, the arteries come in, and then there's a massive system of veins that return it, which is, again, the loop of Henle. And we've talked a lot about the loop of Henle when we talked about the drugs, because interweaving in this loop of Henle is, again, so the blood is filtered. There's lots of fluid going in through here, but your body reabsorbs the fluid and electrolytes. Matter of fact, drugs like Lasix and Bumex, that's exactly how it works, is it restricts the amount of uptake that you get, and therefore increases the amount of urine, okay? So let's take a click, and there we go. Important to point out, this is a child's kidney, by the way.
This animation progressively zooms to more and more microscopic levels of blood flow through a child's kidney. The red blood indicates arterial blood, and the blue indicates venous blood. Note the flow of blood through the renal artery into the kidney, where smaller and smaller arterioles eventually give way to the glomerular cluster. As blood passes through the glomerulus, the glomerular filtrate passes into the nephron. Here it undergoes a series of absorptive and secretory processes, eventually to produce urine.
The simple down and dirty part of it there. Okay, let's see here. Let's close that up. So again, the glomerulus is that cluster shape where the tubules and the substance enters the tubules through the Bowman's capsule. I think that you're going to have a couple of questions on that. And we've already talked about the loop of Henle. We've done that. But it does the forming and eliminating urine and based on two major things, which is the amount of the water balance that you have and retaining key components such as urine while excreting waste such as urea. Again, so you're diabetic with a really high blood sugar, they're going to want to pee a lot more because it's trying to get rid of the waste. Versus, again, if you're dehydrated, again, that's where you quit making as much urine, by the way. And that, by the way, for every firefighter that's ever lived, and now that you guys have ridden on fire trucks, you should know by now, almost every bathroom in every fire station has got the colored pee chart. Again, we want nice, clear colored urine, a little bit of amber. We need to drink some more. If you're peeing out stuff that looks like sweet tea, first of all, it ain't sweet tea. And the second thing is you really need to be hitting the water bottle. Okay. Now, that system, by the way, that controls the blood pressure, again, this is how you control blood pressure on a long-term level, is that you pee out the excess fluid, okay, which is the Renin-Angiotensin System. And it does not involve the urine production, but what it does is it actually helps control the blood pressure of that. And that is actually controlled in the kidney area, okay? So again, it affects glomerular filtration, again, the reabsorption of substances, and then the secretion of substances. So if you have a massive poison in your system, yes, it can actually, you can increase urine production. Now remember, it takes that fluid from your body and your body systems, okay? So that's something that you got to remember about that. Now, by the way, the amount of glomerular filtration that you have is 180 liters a day. I'm pretty sure you're going to see that somewhere later. Okay. But again, we don't put 180 liters of fluid out every day. Of course not. That's why we have that reuptake system. So again, it only reduces the amount of fluid that we need to actually get rid of, or get rid of the poisons, or maintain our homeostasis. Okay. Now, again, the water molecules, by the way, simply diffuse. It's very easy for it to do it and going through that. I'm not going to go into the massive amount of that. The renal tubular physiology allow precise reabsorption of secretions. So just remember, the more urine that you usually produce, the more sodium, potassium, hydrogen, chlorine. It handles all of that. But it's also why you've got a lot of patients on potassium and sodium. Usually their sodium's okay, but their potassium is where they usually dump excess of if they're taking some sort of diuretic. So pretty much if you see them on Lasix, you're probably going to see them on a potassium regimen. If you see them on hydrochlorothiazide, you're probably going to see them on a potassium regimen. Or they're going to be eating a lot of bananas or anything that's got a lot of potassium with it, okay? So, not to go too deep into those things, again, is that you filtrate through the nephron loop of Henle. Again, it's 20% of filtrate water gets reabsorbed, okay? So a lot of reabsorption happens through this process, okay? And remember that this is an osmolarity issue. So again, that's if you see something about that, how does it work? It works on osmolarity. So remember, we talked about that a little bit in anatomy and physiology. It's the shifting of water pressure from a higher gradient to a lower gradient, okay? So now, your glucose, again, is retained in the body, and in the Bowman's capsule, it's freely filtered there. And then osmotic diuretics, as increasingly high blood glucose levels go, so much glucose enters the filtrate that it just, you can't reabsorb it fast enough. Matter of fact, you don't want to reabsorb it fast enough. You want to get rid of it, okay? So again, urea, it's a waste product. It goes through, it's actually about how filtered in the remaining of the urine, and the kidneys are able to excrete this. Usually, here's the problem: when you got so much urea in there, they tend to calcify, and again, we'll talk about that little problem here in just a little bit. The juxtaglomerical cells are the ones that respond to low blood pressure. So, and that's where it produces renin. So basically what it says is quit making urine. So, and that's where that Renin-Angiotensin System happens. It basically says, hey, we're low on water. We need to quit doing that. And then angiotensin 1, it flows to the lungs, converting to the enzyme angiotensin 2, which, by the way, is why when people are on ACE inhibitors, sometimes they have a shortness of breath with that, by the way. And then it acts as the kidney tubular cells and adrenal, causing secretion of aldosterone, which basically, the long and the short of this entire process of the Renin-Angiotensin System is that it tells it to quit making urine, okay? And so it impacts renal tissue death, by the way. And so remember, when the kidneys are told not to work, it's just like a shark flowing through the water. It has to have water going through the gills in order to work. So guys, when the kidneys start to shut down, you start getting death of the kidney tissue, okay? So you need to remember that, and that's why it's so important, by the way, for our patients in our shock states to restart those kidneys as soon as possible, okay? It's great that we can keep their blood pressure up. Here's the deal, gang. If you start losing kidney filtration, we can do all the life-saving stuff in the world, but they die 3 days later because their kidneys have shut down. And again, all of these things are horribly bad, okay? And this goes for any other patient, by the way, which is why this system is so important. So many of our patients actually die from this because even though acutely we restart everything, their cardiovascular system, their lungs, we support all of that, a lot of times we don't support getting the kidneys restarted. Oh, that's the hospital's problem. Well, guess what? It's going to be your problem if they start having kidney damage and kidney death. All right. So again, we've talked about the urinary bladder. Again, everything goes back down. It goes into there. Again, it depends on the sex. For the guys, again, they'll collect in the bladder, and then it goes through the prostate. Remember, the prostate is where all the sexual functions, the sperm is given its volume for fluid. But again, but the long and the short is it goes all through here. And the problem with this guy here is he likes to enlarge, especially as you get older. The larger he gets, the harder it is to pee. As a matter of fact, to the point where it'll actually, in certain prostate problems, actually block off the urethra, and then you've got a major problem because you get the urinary bladder that gets very swollen, okay? Now, the good news is for the ladies, yeah, you guys only have that 3 to 4 centimeter urethra. It's usually really easy for you to pee. For the guy, the average is 20 centimeters. Sorry, gentlemen, 20 centimeters, not inches. Okay, so we go back to the female urethra, though. The problem is with the short urethra is they're very prone to kidney infections. They're very prone to bladder infections, okay? So just remember that. So again, it can be a point for entry for sexually transmitted diseases for the guy in the urethra in that case. The testes again is those are the outside the male system. but remember that it's a muscular stack in the scrotum. The epididymis and the vas deferens is how the sperm again gets back up. That's in the genital urinary system. And again, the prostate gland, and that's where the seminal fluid is made. But again, as you get older, it enlarges, it narrows, it goes to blocking everything. Okay. And again, of course, the male, the penis, of course, the copulation organ, and again, skin covering the penis called the foreskin, and these are sometimes removed, used to be removed. It's kind of fallen out of vogue, but again, it is a source of an infection. Okay, and that's the key thing to remember. All right, that's a review of the A and P. We'll start on the next. We'll start on where we get problems with this on the next one. See you guys.